السلام عليكم طلبة الأعزاء، نلتقي معكم في المحاضرة الرابعة من محاضرات الفارماكولوجي اللي كانت تحت عنوان الأدرينرجيك دراجز. تكلمنا طلاب في المحاضرة السابقة عن الأدرينرجيك أجونست. اليوم راح نتناول موضوع آخر هو الأدرينرجيك أنتاغونست. بالبداية طلاب لابد أن نعرف classification of adrenergic drugs antagonist. It is include alpha blockers and beta blockers. مثل ما عرفنا طلاب most common receptors that present in adrenergic neurons هي البيتا receptors and the alpha receptors in addition to D receptors. So the adrenoceptor antagonist, in addition, it is classified to two types most commonly, plus the adrenoceptor D receptor antagonist, which include beta blockers and alpha blockers. Beta blockers, it is include beta 1 a selective antagonist and beta 2 selective antagonist. يعني طلاب هذه مجموعة من الأدوية تكون سلكتيف على ريسبتر معين. يعني احنا تكلمنا أنواع الريسبترات البيتا موجودة، عندنا بيتا 1 بيتا 2. فالسلكتيف هو فقط يعمل على ريسبتر واحد اللي هو بيتا 1. أما البيتا أيضا السلكتيف على البيتا 2. فأنواع البيتا 1 سلكتيف يشملنا الأتينولول، والبيتا 2 سلكتيف يشملنا البيوتوكسامين. اما النون سلكتيف بالنسبه للبيتا بلوكرز it is include non selective، يعني تعمل على البيتا 1 وعلى البيتا 2. البروتوتايب of these drugs is propranolol. اما بالنسبه للالفا بلوكرز ايضا ينقسم الى قسمين، الالفا 1 and الفا 2. الالفا 1 include برازوسين and الفا 2 include يوهمبين. ايضا نون سيلكتيف، يعني يعمل على الفا 1 وعلى الفا 2 اللي هي عندنا مثال على ذلك عندنا نوعيتين، اكو ريفرسبل مثل الفنتول امين، والريفرسبل الفينوكسيبنزامين. الريفرسبل يعني تكون تعمل على الفا 1 وعلى الفا 2، ولكن بوجود الاجونست كومبيتيتيف اجونست للريسبتر يزيح هذا الانتاجونست ويربط بداله الاجونست، فهذا يسمونه ريفرسبل. اما الريفرسبل فطبيعه الاصله ترتبط بالريسبتر هي كوفالنت بوند، فيكون الدواء high bound to receptors and may causes adverse effect like phenoxybenzamine. Alpha blocking drugs. The first types it is include classification to alpha 1 and alpha 2 blocker, and it is additions to classified to reversible and irreversible. The irreversible because it is bound by covalent bond, it leading to the long acting effect. The prototype of this group is phenoxybenzamine, which is irreversible alpha blockers, and it is only slightly alpha 1 selective. It is important in the treatment of pheochromocytoma because a massive release of catecholamine from the tumor may overcome a reversible blockade. Pheochromocytoma is a benign tumor of the adrenal gland which causes release massive amount of the catecholamine as neurotransmitters, and so it is very important to block the receptor alpha and beta, our alpha receptors, and by use covalent irreversible binding with phenoxybenzamine it is appears the effect. So the second types of the reversible shorter acting, the prototype of this types is phentolamine. It is a competitive reversible blocking agent that does not distinguish between alpha 1 and alpha 2 receptors. Therefore, it is bind to both receptors alpha 1 and alpha 2. What is the differences between the phenoxybenzamine and phentolamine? The differences include it is irreversible binding to alpha receptors, and the phentolamine it is reversible competitive blocking to the alpha receptors. Phenoxybenzamine is highly only slightly selective to the alpha 1 receptors, whereas phentolamine it is not differences or distinguish between alpha 1 and alpha 2 receptors. So selective alpha 1 receptors. The second types of the alpha receptors blocker it is selective alpha 1 blockers اللي هي عندنا prazosine which is highly selective reversible on the alpha 1 receptors. It is this group of drugs it is mainly used for a treatment of the prostate hypertrophy. In addition to prazosine, it is include doxazosine and tamsulosin, which is the differences between these three drugs in the selective on the subtypes of the alpha 1 receptors. alpha 1 تعرفون طلاب ينقسم أيضا subdivisions إلى فكل ما كان highly selective على subtypes of the alpha receptors it is more preferred than others. So it is used previously in the treatment of the hypertension. The more selective alpha 1 blockers include tamsulosin, which is named as traditional name Omnic, and alphazosine are also extensively used in the management of the benign prostate hyperplasia and renal calculi, which is ureters. The second types of the selective alpha receptors blocker it is alpha 2 selective, which is include yohimbine is alpha 2 selective competitive pharmacological antagonist, and it is mainly used for the erectile dysfunctions as local effect on the as injection. In addition to this is groups of the alpha receptors blockers. The beta second types of the adrenergic blockers it is include beta blocking drugs. This is beta blockers used clinically are competitive pharmacological antagonists. The prototypes of the beta blockers drugs it is include propranolol انديرال اللي هو موجود بالصيدليات على شكل حبوب حمراء أو وردية القوة مالته 10 إلى 40 ملغرام. Drugs in this group are usually classified into subgroups on the basis of the beta 1 selective. يعني اكو ادويه من الادويه هذا الجروب ينقسم الى سلكتيف على البيتا 1 وسلكتيف على البيتا 2 ويكون نون سلكتيف على يشتغل على كلا البيتا 1 والبيتا 2. وايضا هذا الجروب يحتوي على ادويه تختلف في بعض الخصائص مثل قسم من هذه الادويه عندها فعاليه partial antagonist وقسم منها عندها cell membrane stabilizing agent اللي هي local يسموه local anesthetic action وايضا قسم منها water soluble and lipid soluble. احنا طلاب دائما نميز لازم اكثر شيء الادويه اللي تكون highly selective على الريسبتر هي more preferred than non selective other drugs that non selective due to degrees of the adverse effect on the systemic. Receptor selectivity البيتا 1 receptor selectivity include beta 1 block more than beta 2 block is a property of acebutolol, atenolol, ismolol and metoprolol. هذه أدوية أمثلة على تكون selective على البيتا 1 أكثر من البيتا 2 ولكن بجرعة معينة، لكن إذا زادت عن الجرعة العلاجية احتمال يتحول من بيتا 1 كلا بيتا 1 and بيتا 2 يعني كلا الريسبتورات يعمل لها بلوك. This property may be an advantage when treating patients with asthma. ليش طلاب؟ لأن البيتا 2 إذا نعمل بلوك إلها تعمل bronchoconstriction ف not prefers in the treatment of the asthma. Nadolol, propranolol, timolol are typical non-selective on the beta receptor blockers, and labetalol and carvedilol have combined beta and alpha blocking actions due to because it causes low incidence to decrease blood flow and low incidence of cold extremities, and these drugs more preferred in treatment of the patients with heart failures. The selectivity is dose related, which means it is tend to diminish at higher drug concentrations or higher doses of drugs مثل ما قلنا لكم طلاب. عندنا الخصائص الأخرى لهذا الجروب هي البارشيال انتاغونست الاكتيفيتي، المثال على ذلك البندولول واللابيتالول والاسبيوتولول. Partial agonists inhibit the activation of beta receptors in the presence of high catechol concentration in case of palpitation, but moderately activate the receptor agonist in the absence of endogenous agonist. هذا البارشال agonist يكون ادى فعاليه عاليه من يكون هناك تركيز عالي من الكتيكول امين او النور ابنفرين موجود بالبلد او بالخلايا، لكن يكون فعاليته قليله عند عدم وجود الريسبتور، عند عدم وجود تركيز الكتيكول امين عالي بالجسم، بالتالي يسمونه partial agonist. partial agonist activity ايضا تسمى بالintrinsic sympathomimetic activity may be an advantage in treating patients with asthma because these drugs are less likely to cause bronchospasm. They also preferred in hyperlipidemia because this group decrease VLDL and increase HDL، وبالتالي يكون more benefit للpatients at the atherosclerosis أو high أو lipid profile changes. Also, partial agonist has less incidence to causes bradycardia. They preferred in patients with hypertension associated with bradycardia. هذا أيضا فدي questions عالية والإجابة موجودة بالشرح للسلايدات السابقة. الخاصية الأخرى طلاب هي local anesthetic activity، المثال على ذلك البروبرانول والميتابرولول. local anesthetic activity معناتها membrane stabilizing activity is a disadvantage when beta blocker are used topically in the eye because it is decrease protective reflexes and increase the risk of corneal ulcerations. لذلك متفضل هذه متفضل في the treatment of the eye condition disease. Local anesthetic effects are absent from timolol and several other beta blockers that are useful in treatment of the glaucoma. These tables show different types of the beta blockers and the characteristic of the selectivity, partial agonist activity, local anesthetic activity, lipid solubility, elimination, half-life. And each of the drugs has different or more same in the same characteristic, and the others it is different. Pharmacokinetics. Most of the systemic agents have been developed for chronic oral use. Like esmolol is a short-acting ester beta blocker that is used only parenterally. Nadolol is the longest-acting beta blockers. Acebutolol, atenolol, nadolol are less lipid soluble than the other beta blockers and more probably enters the central nervous system to lesser extent. لذلك طلاب الاسيبيتولول والاتينولول والنادولول تكون اقل ليبيد سوليوبيليتي وبالتالي ما تخترق السي ان اس او البرين، فالتاثيرات الجانبيه الموجوده ب other drugs have high lipid solubility is decreased than these drugs. So this is the questions what water soluble beta blockers can be detoxified by hemodialysis. Why؟ هذا السؤال أيضا متوجه لكم طلاب، الإجابة إن شاء الله تكون كنشاط علمي لكم. Effect and clinical uses. The effect on the cardiovascular system. تعرفون طلاب الأدوية البيتا بلوكرز تعمل تقليل بالبلس ريت، فبالتالي هذا الشيء يولد لنا negative inotropic and chronotropic effect. أيضا slowed atrioventricular conduction with an increase in the PR interval, and this can be precipitate AV block in susceptible patients with bradycardia or patients taking other drugs that causes bradycardia. The cardiovascular applications of the beta blockers, especially in the hypertension, angina, and arrhythmia, it is benefit because it is decrease the demand of the oxygen on this tissue. Also, treatment of the chronic, not acute heart failures has become an important applications of the beta blockers, especially these drugs include carvedilol and metoprolol, and this is because it is not affecting on the negative or inotropic effect. Some but all not all but not all beta blockers can reduce morbidity and mortality when used properly in the treatment of the heart failures. Labetalol, carvedilol, and metoprolol appear to be beneficial in these applications مثل ما قلنا طلاب. Other effect on the respiratory tract, which is disadvantage because the blockade of the beta receptor causes bronchial constrictions and increases in the airway resistance, particularly in the patients with asthma and patients with COPD. Therefore, beta blockers such as metoprolol or atenolol may have some advantage over non-selective beta antagonist when a blockade of the beta receptors in the heart, which is desired than from these drugs that non-selective beta 1 or beta 2. The other effect on the eye, several beta blocking agents reduce intraocular pressures, especially in the treatment of the glaucoma, which is the benefit effect in the patients with increase in the intraocular pressures. The mechanisms usually reported is decreased aqueous humor productions. The effect on the metabolic, beta blockers influence carbohydrate and lipid metabolism, and catecholamine increase glycogenolysis and glucose availability and the hypoglycemia. This response is reduced by taking of the beta adrenergic receptor antagonist. يعني طلاب المريض اللي ياخذ بيتا بلوكرز بالمريض اللي عنده diabetes احتمال يصير hypoglycemia without symptoms of the hypoglycemia, وبالتالي يصير كوما. لذلك هو it is used with caution, especially that drugs non-selective. Beta receptor blocking agent may mask symptoms of the hypoglycemia such as tremor, sweating, tachycardia, and blood pressure changes. In addition, the non-selective beta blockers may inhibit catecholamine mediated glycogenolysis, thereby potentiating hypoglycemia. Therapy with beta blockers should be administered cautiously in patients with diabetes or predisposed patients to spontaneous hypoglycemia. The chronic use of beta adrenoceptor antagonists has been associated with increase in the plasma concentration of the VLDL and decrease of the concentration of the HDL. وبالتالي هذه it is not preferred in patients with atherosclerosis. يعني هدف معالجة المرضى عندهم atherosclerosis نقلل VLDL أو LDL ونزيد HDL. Both of these changes are potentially unfavorable in terms of the risk of the cardiovascular disease. These changes tend to occur with both selective and non-selective. Therefore, it is not specific for any groups. It is both of the groups, selective and non-selective. They are perhaps less likely to occur with beta blockers possessing intrinsic sympathomimetic activity, which is called partial agonist. The clinical applications of the beta blockers include يعني شنو استعمالات طلاب البيتا blockers. It is include hypertensions and more prefers it is selective beta 1 antagonist like atenolol, نيبوفولول and metoprolol. طيب يا طلاب نيبوفولول هو selective على البيتا 1 ولكن ايضا عنده اندوثيلين ريسبتور انتاغونست فيقلل من الفاسكولار ريزيستنس وبالتالي يعمل لنا vasodilators. The most mechanisms important for these groups it is reduce cardiac output, reduce renin secretions, and therefore it is reduce the hypertension. Also it is used in the angina pectoris in the like propranolol, metoprolol and others because it is reduced cardiac rate and force and therefore it is decrease the oxygen consumptions by the cardiac cells. Also it is used in the arrhythmia prophylaxis after myocardial infarction like metoprolol because it is reduce automaticity of the all cardiac pacemakers and therefore it is causes bradycardia. It is used in the supraventricular tachycardia like propranolol, metoprolol, esmolol, and therefore it is slowed our blockade of the atrioventricular conduction and velocity. It is used in the treatment of the glaucoma like timolol because as a local effect or topical, and therefore it is by reducing of the aqueous humor secretion, therefore decrease the intraocular pressures. The other groups it's heart failures, which is used in the like carvedilol, lapitalol, metoprolol, and the more benefits in the treatment of the heart failures because it is decreased mortality, and the mechanisms out now it is unknown. And in addition to these drugs, there is bisoprolol, which is more prefers in the patients with heart failures and palpitations. Hypertrophic cardiomyopathy. The most common drugs is propranolol. The mechanism of these indications it is a slowed rate of the cardiac concentration. Hypertrophic cardiomyopathy is best known as leading causes of sudden cardiac death in young athletics. Okay, this is conditions. This is frequently asymptomatic until sudden cardiac death, and for this reason, some suggest routinely screening certain populations for this disease is most important. Other applications of the beta blockers or beta adrenergic receptor antagonists, it is a treatment of the paroxysm, which is characterized by unnecessary grinding or clenching of the teeth, which is a problem that is affect about 8% to 21% of the US populations. Symptoms include moderate to severe headache, muscle pain, temporomandibular joint dysfunction, and permanent tooth damage may be persist if the paroxysm is left untreated. The most common drugs for treatment of this disease is propranolol, which can be prescribed for these conditions of the disease. هذا طلاب conditions أكثر شيء أطباء الأسنان لاحظوا بروكسيزم يسمونه، فالتريتمنت مالته هو إعطاء الانديرال. أيضا it is can be used in the migraine prophylaxis like propranolol or metoprolol. It has been found to be effective as preventive medications and reducing the frequency of the migraine. Also, it is used in the treatment of the familiar tremors and stage of the fright like propranolol. وأيضا يعني حالات طلاب أكو حالات أيضا من الفريت من حالات الخوف أو بعض المرات تريمرز يصير، فدرج of treatment of this case هو الانديرال. Other indications of the beta blockers it is include thyroid storms like in thyrotoxicosis. مثال على ذلك البروبرانول, esmolol and metoprolol, atenolol. استعماله بالحالات زيادة الثايروكسين، والمين انديكيشن هو reduce cardiac rate and arrhythmogenesis، وبالتالي قليل أيضا أدى فائدة في تقليل conversion of the T4 to T3. adverse effect of the beta receptor antagonist. مثل ما عرفنا الانديكيشن طلاب، فالادفيرس افكت يمكن ان تكون كالاتي. بالنسبه لتاثيرات على الكارديوفاسكولار system, it is may precipitate congestive heart failures because it is has negative and chronotropic and inotropic effect, and also it is causes bradycardia, and the stopping of this group of drugs abruptly may precipitate of the angina pectoris because it is increase the risk of the sudden death. The chronic use of these drugs can be causes cold extremities because the loss of the beta receptor mediate vasodilatations in the cutaneous vessels, therefore it decreases the blood flow to the lower extremities. Also, it is used in the pulmonary conditions. Can be it is precipitate bronchoconstrictions in patients with has pulmonary conditions like asthma and COPD, especially those drugs that non-selective to beta 1 and beta 2. And also the effect on the metabolic effect, it is decrease awareness of the onset of hypoglycemia symptoms and increase the blood lipid levels. And the adverse effects on the CNS include fatigue, sleep disturbances, depressions, because it is reduced cardiac output and reduced muscle perfusion in exercise. Other side effect, it is not obviously as a result of the beta receptors occurring like bad dreams, which has mainly due to the lipid solubility and penetrations to the CNS. The toxicity include extensions of the beta blockers induced by this agent include bradycardia, atrioventricular block, and precipitations of the heart failures, especially in patients with taking high dose, and also the precipitate of the asthma attack, because it is especially with the drugs that non-selective our high doses of the selective drugs. Therefore, and in addition, the overdosage causes mild symptoms of the hypoglycemia, especially in the patients taking high dose of the insulin. Thank you very much for listening to me, and we hope to attend you for the another lectures.